So, good evening, everyone. We're so thankful today. We have Dr. Peter, who's going to be sharing some of his experience with MLD and his practice as a chiropractor. So, Dr. Peter, can you tell us first about your legacy as a chiropractor, and then what brought you into lymph?
I'd be glad to do that. I graduated from Columbia Institute of Chiropractic in 1976. And since that time, of course, I've had plenty of opportunity to explore and learn other therapies. So I, for example, utilize applied kinesiology, a type of muscle testing to discover various aspects of health. I'm a dietitian, nutrition certified in New York. I have learned NET, which is neuro-emotional technique, an approach to helping to relieve stress and its effects on physiology. I practice applied kinesiology. I utilize that on actually just about every single patient every day. I've done a number of different soft tissue techniques, including ART or active release techniques, Graston. I've gone into some mind body or energy techniques like neuromodulation technique. But my bottom line is always what's going to help my patient? What do they need? Not what do I do, but what do they need? And so this has been the essential element. I also practice auriculotherapy, which is sort of like acupuncture for the ear, but I don't use needles. And I'm quite familiar with meridians, and I utilize that with every patient, at least for evaluation, if not treatment. And herbology, I've been doing that for decades also. So I'd like to just start a foundation here and say that what I think of as holistic care and how I kind of grew into that, learning these different therapies, I think we all have to think a little bit holistically, even if we're specialists. And at one time I thought, oh, I can't be a holistic practitioner. I mean, I don't know the whole of anything. And so I thought, well, I just say I'm eclectic, but I finally grew into it and realized what holistic care really is about. And that means trying to evaluate the principles that go and make up for health, and then directing the patient or treating the patient, with that type of care. So for me, that includes knowing, one, if there's any nutritional deficiencies or special needs. Obviously, an athlete, a sick person, or child, or grandmother, they all have different needs. I want to know if there are any infections or imbalances in the microbiome. And we hear a lot of talk about the microbiome these days, but I can assure you that many times infections are missed in the standard medical care. Somebody's got to pick up the ball there. And so that's up to anybody who's interested, really. So that's the second principle. Third principle for me would be allergies and sensitivities. It surprises me that in standard care that the effects of food, allergies is not recognized. It's kind of thought of as a unusual or rare thing. It's not. It's just so common. So we need to identify these things. And then fourthly, toxins. And toxins are huge. That's maybe, other than stress, maybe like the number one threat, I think, these days to people's health. Just as a small example or two, glyphosate or Roundup is banned in 50 countries, at least. And yet here we spray our food with it commonly, because it's a drying agent or desiccant. That's not good. And some studies, they found that out of about over 2,000 women and children, they found Roundup in 80% of them in their urine. So, hey, this is a real threat. And you think, well, what do I have to offer? But you do have something to offer with that. It's so simple. It can be as simple as giving them a simple herbal thing with dandelion root and basil and burdock. It doesn't have to be difficult. And then we know that in the last 40 years, there's been a 50% drop in sperm count in Western males. Here we got Canada, US, Europe. I think it's probably over 50%. Now you might think, why do I want to go there? If I'm a chiropractor or PT or what? Well, because it profoundly affects everybody's health. You say, well, sperm count, we got enough people as it is. No, it's affecting their health in other ways. So if it affects sperm count, it must affect other things. And if it's affecting many other things, then it must also be affecting women. And then what kind of a population is going to support the increasing aging population economically? So countries have every right to be fearful about that, because we have declining populations in the US, in South Korea, in China, and a number of different areas. And this is only going to get worse. But you and I can make a difference with our patients. We can help them in that way. So that's a little bit about the holistic aspect, except I left out one thing, and that's stress. So anything we can do, whether it's through neuro-emotional technique, which I think is absolutely fabulous, or simply meditation, or simply the way that we talk to people to empower them and make them feel that they're not alone. So that's important. Now, as to why manual lymphatic drainage, caught my eye, well, it was because it sounded so odd. It sounded so different that I thought, hey, you know what? We all need answers, and maybe this is something that has answers that are being overlooked. That attracted me to it. And I'm happy to say that it's living up to my expectations. Now, I'm still new at this. I haven't been at this very long, but I've already seen some very encouraging things with it. I'm finding that toxins and allergies that I test for using applied kinesiology will often test out over the lymph nodes or the lymph vessels. This is the lymph system, where they might not so readily be detected elsewhere. So a lot of times this is towards the end, as people are getting desensitized, but still they have issues. Maybe one or two foods just really throw them for a loop. And I think, based on what I'm seeing here with the lymphatic system, that possibly some of this stuff is still in the lymphatic system, and we haven't been able to clear this out of the body. And then we have some sort of immune response, that's connected with the lymphatic system. So allergies, toxins, and even infectious agents that could get in there. This is another hidden area there. And with the gentlest of approaches, which is what manual lymph therapy, asks for, we can make a difference. We can make a difference. So I'm very hopeful along that line. I thought at first that the lymph system was so distinct, much like the fascial system. It seems to operate under its own rules, and yet I've gradually begun to see how very intimately connected it is. It's just not that obvious at first. I found that the kidney and bladder systems, those meridians reflect that activity, showed that the body was really trying to purge stuff when the lymph system was congested. And that's one of the things I was able to detect around. I thought, I want to see something. I don't just want to practice a therapy blindly and hope for the result. So I had to see, was there some way that I could detect lymph congestion or begin to see that? And so, yeah, there is. It's that same light touch used for treatment that can be utilized with applied kinesiology to verify that, yeah, here's some congestion, here's some congestion. Hey, I see this in enough areas now, or relative to the complaint that, I think that it deserves to be treated. And so, yeah, I'm excited about that. And then, of course, lungs, and I'm sure that I'll see more and be able to relate more. But remember, I'm new at this too. Uh, I'm going to go out on a limb here and I'm going to say something about COVID. Um, And I will say that every person, every single patient that I have seen, just who's had COVID, and they're cleared to come out to the office, that kind of thing. Every single one of them has an adrenal dysfunction at that point. Um, and that needs a boost, like you might give with ginseng or something like that, but it needs to be the right boost. And I can do that with, using kinesiology to find the right herbal approach, but not everybody's doing that. So what would work for everybody? So I was very pleased to see that using manual lymph drainage technique could actually make a difference there to the adrenals. That
Yes.
means the people begin to get their energy back right away, and they begin to recover then, because without the right energy, their immune system isn't going to just be strong enough to be able to help them recover in a timely way. I found that it's also helpful for decreasing electromagnetic sensitivity for those who are interested in that. And not everybody is, but I am, because I see where that also contributes to the picture. I'm pleased to be able to have a therapy now that also allows me to approach some other conditions, I shouldn't say that, but some other subjects that I maybe haven't been approaching before, like pregnancy. Yeah, chiropractors treat, women before and after, but not a lot. But manual lymph therapy has something very strong to offer along that line. And it's gentle and it's safe. And, having these extra tools in along like manual lymph therapy really it just opens up vistas, and it's fun. And it's so nice to be able to offer something like that. For example, here's somebody who just sprained their finger yesterday and it was all swollen. So yes, I know soft tissue techniques and ART and Graston and that, but it's swollen. I'm not going to get in there and do that kind of treatment. It's just not ready for it. We can ice it. Massage isn't really appropriate for it. But that was today, and I was so happy to be able to do manual lymph therapy on that. And it was so easy. Then I put a strip of kinesio tape on it because I also know that kinesio tape lifts the skin slightly and allows for a speedier drainage of the lymph system. So I combined the two, but most importantly, I think, was the lymph therapy that I did. So I took that patient's index finger, worked from that all the way up to the axillary lymph nodes, and he was happy, I was happy, everybody's happy. So that,
Awesome.
yeah. So those are some of the things. Then earlier on, I was sort of like thinking, when am I going to see something big happen? So some weeks ago, I had a patient who was has had a history of problems with blood clotting, over clotting. And so he's been on the thinners, and a prostate problem and low energy. So he just can't get things going there with that prostate, and a fairly young guy. Anybody younger than me is a fairly young guy. But
Okay.
anyway, he was my last patient of the afternoon. So I started doing this therapy on him, a whole body, which takes a while. And I thought, oh, what the heck am I doing? It's the last patient of the day. Why am I doing this? I was just exploring it. I was still early. I didn't really have a single intent on this. I was just practicing and hoping that somebody sometime is going to give me some powerful feedback. And well, did he call up and tell me anything the next day? No, he didn't. He didn't tell me a darn thing. Instead, he sent his wife and said, "You got to go see this guy." But what I found out,
That's the wife.
that's why. So so anyway, she told me, and then he later confirmed when I called him. He said his energy had gone way up, and that evening he just had to go to the bathroom and urinate frequently and strongly, which he hadn't been able to do now for some years. And the next day he was eliminating in a different way. His bowel movements were repetitive. So that was, and his energy came way up. And I thought, well, that was unexpected, and that's just great. So that was a thrill. That was one of my early, uh, conquests there, utilizing that. And so today I had that sprained finger, and then also today I have someone who's a woman in her 20s, and I have these other therapies I've been doing. It's true, but she suffered from food allergy. She didn't even know it. So she would be, nauseous and vomiting frequently over the last, let's say, 20 years. That's a long time to suffer, and nobody suggested that she had food allergies. But we found that, and that improved things as long as she eliminated them. And she had some increased tolerance for it, but we did whole body lymph drainage therapy, and that's made a significant improvement since then. And that was like a week ago. And I said, well, how did you feel? Because most patients aren't going to come back and say, hey, you know what? I urinated 3 times since after I saw you, So you got to ask people and tell them, that let you know what is going on when you do this kind of therapy. How do you feel? Maybe a questionnaire would be a good thing. But I finally caught on. They're not going to tell me about their bathroom habits, probably not most of the time.
But yet it's gastrointestinal and it's so important, and no one wants to say anything.
Yeah. Well, I ask the hard questions, Lisa.
Yes, you do.
I do. Yeah. Well, I told the patient today, I said, I'm comfortable talking about this, so don't you be shy about it. I said, anybody over 60 is just very happy to talk about that subject. I said, you just mention it to your aunt or whatever, and watch your eyes light up with delight. So anyway, I'm joking, but so that means, but that's an important subject for sure. But anyway, so with the same patient who was in her 20s and thrilled that she's starting to eat all of the foods that previously has given her severe, reactions that come on very quickly. And I see it's made an improvement in her neck. So she didn't have the stiffness and tightness in her neck and shoulder. And I also find that it helps to stabilize the pelvis. And I'm sure other areas too, but
Yes.
but the pelvic area is a great place to go. So I go, front and back there. So maybe the inguinal nodes and over the sacrum and coccyx and across the sacroiliacs and a little bit in the lower back. But you'll find out if you take the online course or study manual lymphatic drainage, it really does make a difference to stabilize. Now, is it going to fix everybody? No. But will it fix a number to make it worthwhile? It will definitely make a difference and be worthwhile. So I'm excited to see what more I can discover here with allergies and toxins and, some of the conditions that I maybe didn't treat before. I'm thrilled to hear about their interest in Alzheimer's and dementia. We hear so much about it these days. I mean, that's a scary subject, which should be for most people. It's like a lot of illnesses would be better than that one. And what do I think is going on? I'm positive that it has a lot to do with toxins, but what's going to make a difference? And I know there are plenty of practitioners who are saying, oh, well, I do nutritional therapies to detoxify the body. And those are powerful too. I mean, in 2-3 weeks, for many patients, you can reduce their symptom load by 50% with a good dietary detoxification approach using some supplementation. It can be done, but it doesn't get everything. And we have to have some other tools to go fishing with and to evaluate with. And the brain sometimes is a tough area to get it out. And we have some other areas in our bodies like the prostate or the pancreas that where things get sequestered. For example, pancreatitis, you don't hear about, you hear about it when the person has become severe and develop it, but you don't hear about it leading up to that point. We need tools to be able to detect, but even more importantly, to be able to make a difference and clear that out. Because I know from experience that toxins and, germs get in there. And I'm pretty certain the same thing is true with the prostate. It gets in and can't get out. We need tools to do that with. Well, maybe, and I think manual lymph therapy or drainage gives us another opportunity, another avenue to make a significant or very important difference there. So I know that, Lisa, you've taught me that the brain now they discovered has lymph vessels in it, and that the top experts in the world, they didn't know about that. Well, then when they discovered it, well, I don't know, was it 2015 or 2017?
Yes.
Yeah.
Yes.
They
2015.
And they were incredulous. They couldn't believe it. They didn't know what they didn't know and didn't see what was there in front of them all that time, because those lymph vessels are like hair-like structures. And so they can be missed. But they're there for a reason, and they can be, we can do something about that. So what's the difference? Well, you may not know that as a practitioner, that you help to prevent, Alzheimer's in somebody when you begin the process. But the most important work we do can be preventative work. We want our patients to come to us, feel better, but we'd like them 10, 15 years down the road to be as good as they are when they seek, when they finish or when they come to us. We want that for them. We want the long-term result, not the quick fix. So anyway, that's some of the stuff that I've been up to. I see scars. I know some people are interested in scars. And there's different approaches for that. Manual lymph drainage could be one of those, and that works fine. But there's some other easy approaches too, which we'll get into someday. Anyway, that covers most of what I had in my mind today. So is there anything, Elise, that you'd like to know or ask me?
Yes, Dr. Peter, you covered a lot of ground that I think really resounds with therapists and probably a lot of patients that are going to watch this too. Back in the day, and I'm going back to when I was in school back in the 1980s, was this a topic, lymph? Was that a topic for chiropractors? I know for massage therapy and occupational therapy, the teachers actually came to me because I worked for the doctor who brought MLD to the US. Even though it's a German modality, he brought it here through their help. And they asked me to teach the class, and I'm a student.
Huh.
Did you ever feel like that? Did you just feel like I'm at a loss for words for the lymph system back then? That's where we were.
It really didn't come up as anything at all. We didn't study it. We heard the words briefly, but it wasn't really a topic that was of importance to us at that time. So even not so many years ago, I just thought, well, I understand some people can do something special if somebody's got lymphedema, and then they put their hands and they just do a very, very slow approach. And it sounded so boring, just, just like take somebody's knee and hold your hands and work like that for an hour just on their knee and barely doing anything. I had no idea what was involved with that. I didn't distinguish lymph nodes from lymph vessels. I didn't realize that, massage wasn't really lymph drainage, because those lymph vessels are so narrow and fine, like a hair, and that they get compressed. So massage per se doesn't really do the job. Manual lymph drainage is a whole different modality than I think what most practitioners know. I don't think we have any idea about it for 99+% of us.
So I really appreciate your honesty. And I've worked with 5 chiropractors now. They're friends of mine. And they tell me, Lisa, when I was in school, we didn't talk about this. And in fact, just recently, I've had some chiropractic schools asking us to bring it out because it's in the public, it's in the news. And where did it happen? Especially during COVID, when everyone wanted to know about their immune system. That, I think, was a light bulb for America. And so doctors like you that are coming forward and saying, hey, we don't have all the answers, but we do know where we're going. We were in the past, but we're coming into the light now. And we see changes are happening, even if it's only a case study for now, until we get further grants to look even deeper. So we really appreciate you taking time for your colleagues to hear this, because I've had chiropractors who said, do you know any other chiropractors that use MLD? Well, you're one of them, and you're making strides. And I've also wanted, I'm sorry, I didn't mean to interrupt you, but it was so important what you said about infertility, because we're finding, you did one study, I did another study, and we found that in the breast milk of women in US, that 100% of all breast milk is contaminated with toxins. Now, if that's in the breast milk and you're nursing the baby, now that makes me, that's just my mind thinking out loud, is this the reason for autism and some of these other spectrum disorders? Is it because they have 2,000 times the amount of toxins? They found this out in the National Institute of Health. And that has to do with your lymph system. So are we going to be seeing our chiropractors and our healthcare practitioners that want to keep us well for a lifetime?
Mm.
And I think so. So please, if you would, if you'd like to share your email or your phone number where people can get in contact with you, we would love to have that information, because I got the feeling we're going to see a lot more of Dr. Peter. He's
Okay.
got a lot of thoughts on his mind.
Yeah. Okay. Well, I'm sorry, was that a request for me to say something more?
Yes, please tell us your number or your email or something that people could reach out to you.
Okay, well, my email is Dr. Peter Kladstrup, and Kladstrup is spelled KLAD as in David, STRUP, and that's at gmail.com. And phone number 585-425-3626. But again, I'm not the expert here. I'm just the intrepid explorer here. And you're the expert, right? So I was thinking, though, a little afterthought here, that it's fine for me. I've got some tools to kind of help me evaluate and get a quick, take on the lymphatic system. But we come at this from different perspectives, and some people are just, they're even new to the healthcare, as a practitioner. And by the way, non-healthcare practitioners can be taught to do this too, is what you had told me and showed me. So that's a neat thing too. But I think what we need to be able to be able to share at some point is, how can we help people to get involved in this more? Because it's sort of like fishing blindly at first when you're starting out, not quite knowing what's going to happen or if anything is going to happen. And how do we work this in a timely way? What are the expectations here? And maybe that varies with the type of practice that the person has. But I think maybe by talking to someone like you, maybe me eventually, we can begin to say, well, here's what you can begin doing, because there's whole body therapy, which has its major, impact on the body. But sometimes we don't have an hour to throw in at that moment, and we need to have some other strategies and have an expectation and a way of communicating that to our patients, Well, that's my thought anyway.
I think you're right on, Dr. Peter. And one thing I would leave the audience with is understand that in Germany, the hub of lymphology, that they take months to study this topic, where we only take days. In whether you're an OTPT, RN, doesn't matter. We take days where they take months and years. So we're in the catch-up phase here in the United States with this, and more is coming out. And I work with a chiropractor, by the way, and his whole philosophy is based around the meridian therapy and MLD. So we will have to come back, guys, and do another video, because that will be one not to be missed. Not that you missed this one, but you want to come back for number 2. So thank you so much, Dr. Peter, for your time
You're
tonight.
welcome. You're welcome.
Awesome. So, Dr. Peter, I was going to tell you,
Are we off?
yep,
Are we?
we're
Okay.
off. I clicked it off, but I thought when I heard you, I got to introduce you to the chiropractor that introduced the MPS unit,
Mm-hmm.
and that we work with him.
Uh-huh.
So that with the MLD, we know that those meridians, what we call meridians, are lymphatics. I
Oh,
feel like the Chinese already had the system mapped out long before we did. They just called it something different.
oh, uh-huh.
We're calling it lymph system. They called it meridians. But there's a whole advanced practitioner level, and I know that he would love to meet you. So I don't want to leave you hanging. I'd like to get you
Okay.
in contact with him.
Okay, sounds great. Well, you know, I'm coming to Florida on June 17th.
Yes.
Yeah, I'll be there for 5 days. So maybe
Well,
we'll
I
meet.
hope to meet you.
Oh, that would be nice. I'd like that too.
So thank you so much tonight, and thank you for your time. I know you had to borrow the room, so I'll graciously give it back
Okay.
to Carol. Thank you, Carol, for your
Sure, a pleasure.
time back there.
No problem.
But I think this is going to be perfect. It's really covered a broad base of topics that people are interested in, want to know more from their chiropractor. So stay
Okay.
tuned.
All right. Bye, Lisa.
Bye-bye.